All right, today we're gonna be demonstrating a technique for dry needling to help patients with TMJ or headaches relating to TMJ. So the first needle that we're gonna insert, we're gonna come along her zygomatic arch here up into the mandible and find her TMJ. Then we're gonna step just slightly anterior to the jawline and insert our first needle here. And for this, we're gonna use a 15 millimeter needle. I'm gonna go until you feel a hard end feel, aiming for bone or epimysium. You okay? All right, next we're gonna go just inferior to the first placement, and we'll be targeting the tensor or levator tensi palatini, which also has an attachment into your auditory canal, resulting in some ear pain or tinnitus with associated jaw pain. Okay, so from here we can place our needles in a few different positions depending on what specific symptoms that the patient is reporting. So for example, if they have headaches associated with the TMJ dysfunction that is located along their lower orbital region or their zygomatic arch, we can also stick a needle right over the bone there. And another one into the zygomatic arch more laterally. Good. So another component of this treatment that we're not going to demonstrate in this video is that we would also be placing some needles into her cervical spine along the suboccipital region and along the transverse process of C2 to further help target her autonomic nervous system and promote greater homeostasis. For now, we can go, say she has some headaches associated along the frontalis muscle here. Good, we hit bone pretty quick there. This is really good for headaches. And one more along that bone. Good. Okay, one more place I'm going to show you to put a needle in this situation is going to be into her medial pterygoid muscle. And that is accessed by coming down along the mandible to the inferior angle, and we're going to come straight up under her jaw. So depending on the person, you might need a little bit longer than a 15 millimeter needle for this one. All right, good. Let's get a close-up of her face. So some other common needle insertion points for people with TMJ dysfunction, and again, it all depends on that patient's specific symptoms. We could insert along her sternocleidomastoid muscle, which would then, if that were to be tight, pull her into more of a forward head posture, creating some more tension on the posterior aspect of her head and neck, further creating headaches. And same with why we would place those needles in the base of her skull and back of her neck as well. And then say she were to have some more tension-based headaches along her temporalis bone, we could put some needles here as well. There will be video content of this on our YouTube page.